I'd like to introduce our speaker, Dr. Alice Rothchild. She is a retired OBGYN who worked in the healthcare reform and women's movements for many years. Since 1997, she has focused much of her energy on understanding the Israeli-Palestinian conflict.
Okay, so I'm going to be talking about the health and human rights consequences of the war going on in Gaza. Now, the first thing that I think we need to be aware of is that healthcare in Gaza is provided in the context of a siege, checkpoints, closures, curfews, a strict permitting system that entails everything and every person that goes in or out, the separation, the apartheid wall, militarized fence along the perimeter, multiple Israeli incursions, massive assaults, detentions, and factional violence. And I think if we're thinking about health and human rights, we need to think about some ethical questions. We need to think about the role of international law and collective civilian punishment. What happens when a population has severe restrictions of access and is ghettoized? What happens when there's a large amount of incarceration, especially of children? And then the whole issue of the proportionality in war. And we need to remember that healthcare and healing occur in a socio-political context. And what that really means is that we need to have political solutions to health and human rights issues. I'm going to read this slide because this is your take-home message if you only remember one thing. More than 75 years of Israeli domination and dispossession has affected Palestinian life through occupation, siege, annexation, de-development, and permanent displacement of refugees, severely impacting the ability of Palestinians to access the essential building blocks of health. The fragmentation of society and destruction of the ability and opportunity to create essential institutions involved in healthcare has created a reality that is recognized today as medical apartheid, two separate systems, two separate realities. And we clearly see this in the disparities in life expectancy and maternal and infant mortality. Now, medical apartheid happens because of a deliberate Israeli policy of de-development of the healthcare system. So the Israeli government does not allow equipment to get in, critical medications to get in, the building blocks for building better hospitals to get in. They have a severe permitting system. So if a patient needs high-level care in East Jerusalem or Israel or Jordan, they have to go through bureaucratic hoops to get the permit, which is not guaranteed and sometimes comes late. And as I said, there's a chronic lack of critical medications and equipment. Then there are the direct attacks on healthcare facilities, and the area has a high level of conflict-related trauma.
First question we received in advance asked, what is the impact of the assault on Gaza on the healthcare system in the West Bank?
So what's happening in the West Bank, people are calling it the Gazification of the West Bank. There has been a marked increase in settler violence, and Netanyahu and Smotrich and Ben-Gvir and all those kinds of right-wing folks have basically unleashed the settlers on Palestinians, particularly in Area C, which is the 65% of the West Bank that is totally controlled by Israel. So there is a huge amount of trauma and killing. I think there have been 400 people killed so far, destruction of homes, massive amounts of trauma happening in the West Bank. I haven't seen direct attacks on hospitals, but I could be wrong on that. But the population itself is suffering massively from injuries and death and home demolitions and displacement at a marked increase level from before October. And so what we see is that under the cover of war, the settlers and the Israeli government are really trying to seize as much land as they can get and drive Palestinians off that land. And the other thing that's happened is that there's a total closure. And so, the thousands of Palestinians who were working in Israel are not able to do that. So there's rising levels of poverty and difficulties getting to healthcare. It is almost impossible to get to East Jerusalem for high-level care. So the whole area is shut down. People are restricted to to stay within their towns and villages. They have to get permits to move from place to place, and it's basically largely shut down. So you can imagine that not only is the economy impacted, but people's health is impacted because they can't get to healthcare, they can't get their medications, they can't get to their tests because they have to. Their towns are all shut down. So I think that's where the impact is primarily happening.
Okay, thank you. Another question: have you been able to be in touch with any of your friends and contacts in Gaza?
So I work with a group called We Are Not Numbers, which is a group that mentors young Gazan writers, young being 18 to 30. So I'm the mentor liaison. So I'm the person who gets the stories from the Gazan writers and matches them with English-speaking writers. And then they mentor them, and we put their stories up on the website, wearenotnumbers.org. Highly recommend that. So I'm aware, in touch with all these writers. And some of them are dead, first of all. We've lost a number of writers. A lot of them are sheltering in the South in horrific conditions, usually without internet, without electricity, and barely able to write. So we're getting bits and pieces from them. There are some that are actually able to write essays about what's going on. Often they're writing them, on their phones or on WhatsApp. And then sometimes they're writing short messages whenever they get electricity. And then their mentor weaves it all together into an actual essay. But we are getting, I am seeing firsthand information. The other thing is that when I wrote my piece for the New York Times op-ed, I was able to interview 2 pregnant women. And I do know what's happened. I'm still in touch with the main woman in the story. She was pregnant when I was writing the op-ed with diabetes, without healthcare and without insulin. She was a dentist. Her husband was a doctor. They were middle-class people living in Gaza City with 1 child. And this pregnancy, she did ultimately, they did flee to the South. And I think they moved 5 times. And they were living in really horrific situation. She did end up with a C-section and had a healthy baby. At the age of 1 month, I learned that the baby has chronic diarrhea and hepatitis A and is dehydrated and sick. I haven't been able to hear from them since. The father did try to get the baby admitted to the hospital nearby in the South, and the baby wasn't sick enough to be admitted because so many people are so sick. So the chances of that baby surviving, I would say, are kind of dubious because, when you're 1 year old, it's not good to have hepatitis A and chronic diarrhea and dehydration. So that's the baby I know about. I have some other friends and colleagues that I've worked with, and I've had little bits of contact with them, and mostly it's really horrific. Many of my friends have lost 10, 20, 30, 40 family members. Many of them are living in tents. It's just horrifying. A lot of folks are trying to get out. And I don't know if you know about the getting out procedure. First of all, it's almost impossible to get out. You have to get on a list, and the list is controlled by Egypt. And there's a whole Egyptian security thing that goes on where you basically have to pay, quote, a bribe to the Egyptian security to get on the list. So paying the bribe doesn't actually mean you'll definitely get out. The bribe used to be, like when I was there in August, it was maybe $250, $300. I think it peaked at $10,000. This is per person. So if you're a typical Gazan and you have 6 siblings and a mother and a father and a grandfather and a grandmother, you can imagine how much money that is. And now I think it's down to $5,000 per adult and $2,500 for a kid. But I know people who've raised the money and still haven't gotten out. So it's very, very, very desperate. And getting out, you have a couple of days in Egypt. Egypt doesn't want you to stay there, and you have to have plans to go someplace else. And so it's just catastrophic.
The one questioner asked, since you've probably spoken to members of Congress, what's your experience been when you share this information with them?
Well, when you share this information with somebody like Taleb, she's very sympathetic. When I share the information with my congressman, who is Adam Smith, he talks about the two-state solution and how he cares about Palestinians, but Israelis have the right to defend themselves. And he just is in this sort of circle of statements that he's been saying for a long time now. So I don't think that, for instance, my congressman are making much of a dent. But I think that there is an impact to having so much opposition to what the U.S. is doing. But the Congress is a really slow place without a whole lot of brave people. I think that there's a tremendous amount of belief in the idea that Israel has, quote, the right to defend itself, even though you could raise issues about whether that's exactly what they're doing, which I wouldn't say that's what they're doing, and a tremendous amount of sympathy for the hostages, which is obviously appropriate. But I find that although it's very important for Congress people to hear from us, it's a bit of a head-banging kind of experience. I don't know if people have had more positive experiences. I will say that there are 6 bills in the U.S. Congress to defund UNRWA, and today I heard there was a new bill signed by 20 Congress people, and you can guess who they are, wanting to fund UNRWA. So, there are little moves in Congress that you can see.
That does lead to another question, which is, what do you think we can do?
So I think there are a lot of things we can do. The first thing is that we are all responsible for being educated. So you've got to go beyond mainstream media. I recommend people read Mondoweiss, Electronic Intifada, Al Jazeera, listen to Democracy Now! If you do those things, you will know what's going on. And then it's critically important to talk to family, friends, the communities in which you live, and be brave about having those conversations. I think then it's really important to attend to what's going on in the media, to write a ton of letters to the editor when media gets it wrong, to use your social media accounts to spread the word about what the factual information is. And then it's really important to get out and protest and march and cause a fuss and, call your congressman every day and say, hello, it's me again. So many more people have died. There are 2 mothers dying every hour. There are 10 kids that lose 1 or 2 limbs every hour. This is not okay. As a physician, I would say that one of the things I am deeply appalled about is that the professional medical organizations, who were very happy to talk about Ukraine and make all sorts of political comments, have been utterly silent on this, except for the American Public Health Association. So I think all of us who belong to any kind of professional organization should be pushing our professional organizations to say something. And, it doesn't have to be wildly political. I mean, pediatricians could say it's not okay to kill 15,000 children. Obstetricians could say it's not okay that women don't have prenatal care. Orthopedic people could say it's not okay to be shooting at young men's lower extremities. That you could just make a medical statement that calls attention to the kind of behavior that's going on. And what we've had is complete silence. American Medical Association has absolutely refused to deal with this. So there are all sorts of ways like that, if you belong to some kind of professional organization, that you can nudge them to be braver. So that's, I think, the things to do.
And we'll have a few other suggestions at the end of the program as well. The next question comes from a retired Iranian-American psychologist and peace activist who asks, besides brainwashing, what do you see as the psychocultural roots of Israeli extreme meanness?
Well, I think, first of all, to understand the sort of mood in Israel, before this all happened, the sort of progressive elements in Israel were out demonstrating, hundreds of thousands of people demonstrating over and over and over again against Netanyahu and against his what he called judicial reform, which was basically an attempt to muzzle the Supreme Court and pack things so that he could stay in power. Because you got to remember, Netanyahu has to stay in power to stay out of jail. So he's like really highly motivated. So that was going on. And the Israeli government had fed the Israeli population the false idea that they were safe, that you could just, quote, mow the lawn in Gaza, which is what they actually call it, every couple of years, smush them down back into the Stone Age, and then while they crawl back up and redo their institutions, we're fine. And if they get to a particular level, we'll smush them down again. And that was Israeli foreign policy as far as Gaza went. And the Israeli population bought that. And Netanyahu was very, very focused on seizing land in the West Bank. And so much of the military was in the West Bank, supporting the settlers, joining in with the settlers, doing their horrific things. And so the military bases were actually not staffed in the South. So then this, and the other crazy thing is that the Israeli surveillance system had the plans that Hamas laid out. It was a very detailed plans. And the other thing is, and they ignored them. And the other thing is, when I was in Gaza in August, I visited this guy who's the head of a human rights organization, and he has this fabulous olive grove that's right up against the eastern perimeter. It used to be that his family land went, for acres and acres beyond that, but this is what's left. And from his olive grove, I could see, he could look down at the bottom of the hill where the Hamas training center was. So you could actually watch Hamas people doing their practicing. And then right beyond that was the perimeter fence. And then there was an Israeli guard tower. So the Israeli military was actually watching Hamas prepare for this. And they completely dismissed it. Hamas couldn't do this. They don't have the personnel. They're completely inept, whatever their feelings were. So when Hamas actually broke through the fence and took over Erez checkpoint and did all this killing and hostage taking and all the really horrific things that they did, people were like completely blown away and traumatized. And they were traumatized partly because some of their loved ones were kidnapped or killed or injured and all of that kind of stuff. But they were also traumatized because they realized they'd been fed a lie. And so all of these reservists who had said, we're not going to join the reserves, we're not going to fight, we're against Netanyahu. As soon as the attack happened, everybody rushed to be patriotic and rushed to defend the country. So that often happens in a time of attack. I mean, if you think about 9/11 here and the mood of the country and the sort of hatred of Arabs and all the crazy stuff that went on here, and then, we run off and attack various countries that were not the right thing to do. That's kind of what's going on in Israel, except it's a small place and everything is up close and personal. And, there's also the problem that there is attacks from the north, from Hezbollah, and Israel is bombing Lebanon. And so the communities along the northern border have been evacuated. So there are all these displaced people in Israel. So there's a huge amount of trauma amongst Israeli Jews and amongst Israeli Palestinians as well, because some of them got caught up in this. And there's also a huge amount of rage, and there's a huge amount of fear. And I think we're seeing that mix. And then you have a very fascistic right-wing government that is feeding the worst things you can imagine. I mean, calling Gazans animals and talking about making a Gaza Nakba and just awful, awful stuff. And you put that all together and you get what we have now.
Okay, a couple more questions I think we have time for. This one, I think, is one a number of us were wondering about. How do you maintain your sanity?
Well, you're making the assumption that I do. So I'm angry and depressed a lot. I'm someone who prefers to make noise than be quiet. So I find it better for me to be speaking out and writing and causing trouble than being silent. I have this sense of grief that is so profound that is sometimes hard to get through the day, but that's because I'm a human being. And I'm also fully aware that I'm a privileged person living in Seattle and no one's bombing my house. And, I have enough food to eat and I've got 2 fabulous grandchildren and I can hike in the mountains. I have my escape ways and that's a great privilege. So, it's a juggle, it's a balance. And, I'm not going to pretend that I figured out the balance, but I certainly feel better doing than just being passive. And I also feel that our country is funding this. We're about to give Israel, if the Republicans can get their act together, kabillions more dollars to drop more bombs on Gaza. So we are infinitely complicit. And then I have this state that says that it speaks for the Jewish people, even though it doesn't. And so I feel incredibly responsible for everything that's going on. And I feel like for those two reasons alone, this is something I can't put down. And also, I've been to the region. I have friends. I have colleagues. I've been to these hospitals. I've worked with human rights activists. I've interviewed fishermen who've been shot at by Israeli gunships. I've talked with women who have a garden that gets shot up by Israeli soldiers. This is not theoretical for me, and so it's very powerful to be involved in it.
Okay, this last one is, I think, a very appropriate final question, although it's an impossible one.
Go ahead.
What does Alice think is the end game for Israel?
Well, Alice is not sure what the end game for Israel is. There are several, I think there's a lot of conflict within the Israeli government. I do think that when the Israeli forces went into Gaza, they didn't have an end game, that they were like doing reaction. And I think there are forces within the Israeli government that want to depopulate Gaza. They want Gazans to be living in the Sinai in big tent camps. And, Egypt was like, no, no, no. And now they're building a big camp for Gazans. It's not big enough to bring all of Gaza into the Sinai, but just this alone is really frightening. And Egypt is also being offered financial and military stuff as incentives. Come on, just a few Gazans will just, a couple of 100,000 kind of thing. So one theory for me is that the Israeli government wants to depopulate Gaza and have Jewish settlers move in and just call the whole thing over. The other thing might be that they're going to let Gazans exist in the south, but not in the north. And I've also heard that as a possible thing. And the other thing is that at some point, the Israeli government will say, we won, and then they'll go home and they'll have a strict siege and we'll go back to like plan B, And the thing that's crazy about that is that you can't win by defeating Hamas. Hamas is a liberation movement. It's not monolithic. It has a long and complicated history. They came into power not to destroy the Israeli state. They came into power advertising themselves as clean government after the corruption of the Palestinian Authority. And then, we know the rest of the history from there. They have a huge number of social service agencies and orphanages and universities and all sorts of that kind of good Muslim stuff. And they have a militant wing. And so you can't defeat that. So the people in Gaza that I talked with didn't like Hamas one bit. But when Hamas, pokes their finger into the Israeli eye, they are thrilled because no one's doing that. So I don't know what's going to happen in terms of how Israel's going to play this. I don't see any particularly good outcomes right now. And the other thing that's very clear, I don't know if you're aware, but the Palestinian Authority, the cabinet just resigned and the prime minister resigned. And clearly there's this pressure to, quote, clean up the PA, and then maybe we'll give them Hamas, which they need like a hole in the head. And this is a really terrible idea because the PA, the Palestinian Authority, was created to be a collaborator with Israel, to do Israel's dirty work. So the PA spends more money on weaponry and military to protect the settlers than on health and education. So it's going to take a lot more than changing the cabinet to clean up the PA. And this is a settler colonial state. So if you don't deal with that power dynamic, you're just continuing the issues that we currently have. And I'm sure that Gazans do not want to be led by somebody that is acceptable and chosen by the Israeli government, because then that's just another collaborative kind of leadership that's going to do Israel's bidding and won't be good for Gaza. I mean, Gazans need to have the power to govern themselves. They need to have, first of all, a ceasefire. They need to return the hostages. They need to have the ability to have self-determination. And, this is where if we got in that direction, there's a possibility that this catastrophe could end. I think one thing I just want to add at the end is that although someone like me is not particularly welcome in the Jewish community, that doing this work has created this huge community, both of progressive Jews, but also given me the opportunity to get to know all sorts of Christians and Muslims and Arabs and all sorts of folks that I wouldn't normally have. So I have a much bigger community that I feel like I'm working with, and that's one of the benefits of doing this work. And also, once you get into this, you realize that this is a global movement. And, you know, so much of the assaults on Gaza and on Palestine have been kind of invisible, under the radar. And now, particularly with social media and with sort of increasing awareness about settler colonialism and racism and all those kinds of things, this is not happening in the dark. And I think that that's going to really change how ultimately this will come out. But there is a tremendous amount of work to do. And the other thing to remember is that there are people who are benefiting from this war, and there's a massive military, industrial, corporate surveillance complex that is very happy as a clam to be doing this. And they're making billions of dollars, and they're salivating at the money they're going to give Egypt when Egypt takes Gazans, and the money they're going to give and the weaponry they're going to give to Saudi Arabia when Saudi Arabia agrees to recognize Israel. Well, you know, this is sort of infiltrating into the Middle East. And so we have to remember that we need to pay attention to those very dangerous industries that are doing very well and love war and love us to do this more and bomb more people. And so that's another aspect of the protesting we need to do.